Hello and welcome to this discussion on evidence-based public health. This is Dr. Lori and I'm happy to invite you to join me in thinking about public health in this evidence-based way. First of all, as we're getting started, I'd like to just kind of put out a definition of public health. And there are many, many definitions of public health, but this will kind of help us to frame this topic a little bit. Public health, in my mind, is pretty much any organized effort to improve health on the community or the policy level. So public health is this effort of many people trying to band together and think about how we can make our communities a better place, not just one person at a time, but thinking about how a lot of things interact with each other to affect the whole population. Now, if we think about public health as that organized effort, I'll just put that here. Then evidence-based public health is having that organized effort based on evidence that we have that we can collect and use to make sure that that effort we're putting in is going to do what it is to improve the health of that community. So here's a little bit of a graph. And this has to do with the H1N1 in the United States in 2009. That was a particularly bad incidence or a bad season for the H1N1 disease. And this graph is trying to take that information, organize it in such a way that we can see what was going on. And so a lot of times in public health, we're trying to take the information that we have. There's a lot of kinds of things that we like to draw into this particular conversation. A lot of times it's about what's going on. And that what is the relationship maybe between a risk factor and the disease of outcome. What risk factors are there, what disease is happening, what is it that we're noticing. And then also kind of surrounding that whole conversation is the who, the when, and the where. In this particular graph right here, we're talking specifically about the United States, but we could have organized that information by state by simply putting the information on a map. Or if we were just thinking about the state of California or some other state, we could have arranged it that way, depending on per population level or just the raw numbers. So the who, when, and the where really helps us to see what kinds of factors would we be able to impact in order to do that improving of health, that organized effort to improve health. In this graph here, you can see that they broke it down into age groups, because a lot of times the diseases that we're thinking about impact specific age groups more heavily. And I would say the vast majority of diseases that we know of impact the very young and the very old, more disproportionately to the middle ages, kind of the sort of healthy ages in between. Now this is an exception. This H1N1 is actually impacting this middle age group disproportionately. Now it is the largest age group, and so then you have to look and see what is it that we're really putting this up against. Is that it a per 100,000 or is it a total number of people? And so obviously if we have an age group that goes from 18 to 64 years, that's a much wider range than the 0 to 17 years. And the above 65 kind of is open-ended. We could get all the way up to centenarians and above. And so, but that age group kind of tapers off. This graph also has organized this by time frame. And so we're looking at the different kind of April through October of 2009. Then we go April through November. We're adding April through December, April through January. And so we're looking at different time frames and seeing the cumulative effect. So being able to take that raw information and package it in a way that answers a specific question of possibly who, when is this happening, where is it occurring, those kinds of things. So in public health, essentially, we're trying to take information and package it in a way that makes it easy for other people to follow what that means. And so we've talked a little bit about the determinants, these factors, some of the other determinants, how it's distributed among the population, and finally, we a lot of times are talking about what's called morbidity and mortality. Morbidity being how many people are sick, mortality, how many people died. And so we're thinking about what's causing the disease, how is it distributed among the population, and then also just how much is this impacting our population. Historically, and we'll get into this much more when we talk about the history of public health, but historically, before about 100 years ago, very much of public health was organized around infectious diseases, and that's because those were the things that were happening at that time. People would die at a young age due to something that they caught, and it was just very noticeable that that was one of the most important things, that if you're going to make an organized effort to improve health, that's something that you would try to address. Now, so public health was born out of this effort to really address infectious disease. And there are pluses and minuses to that. The pluses are that we've done a pretty good job at figuring out the determinants, the distribution, the morbidity and mortality, and improving health for infectious diseases. We've done a variety of different things to help make a dent in infectious diseases. And so people are living longer, they're healthier, they're able to survive a lot of these dangerous time periods in their life. But what that also means is that public health is sort of based on this concept of thinking about things in terms of surveillance, outbreaks, that kind of language and that structure, where we're trying to approach health from a construct that works really well for infectious disease, which it does. And over the years, that has morphed into being equally or more important. Public health is addressing things that are chronic diseases. And so quarantine, for example, doesn't work for a chronic disease typically. And so the kinds of things that we do also need to change in public health if we're going to be effective in this organized effort to improve health. If the target is moving, if we're moving from infectious disease to now including a lot more chronic diseases, then we need to also be thinking about ways that public health can address those kinds of issues. So where we used to have pandemics or outbreaks, and we have surveillance systems and those kinds of things, now we need to also be morphing those into systems that will help us with chronic diseases. So that concludes my short talk on evidence-based public health. Next, we'll look at some things related to qualitative versus quantitative data.